So look, I want to kind of switch gears, right? I want to ask this question because I know that you don't work just with Black clients. You work with
Yes,
clients of all different backgrounds. And
yes.
so one question that I wondered, if you have any observations about two things,
Okay.
right? What are some of the universal themes that you're finding all communities are experiencing, right? In
Mhm.
terms of what they're coming in saying, these are the issues that are troubling us.
Yeah,
But,
definitely.
but then, sorry, but
Oh my
sorry, it's
God.
two part. It's two part. But then the other side is, what are, one or two, if there are any, what are some specific things that seem to be unique to particular communities?
Good question. So I think in terms of like, yes, we do see not only Black clients,
Hmm.
we see Asian, we see white family, mixed
Hmm.
race family, and one of the things that also are unique to just all the clients we see and all human beings is that we're all living within a culture,
Yes.
right? And our culture influences the way we are and the way in which we see ourselves, the way we
Hmm.
bring ourselves to relationship, and the way other people see us and interact with us. So it can be our gender, it can be our race, it can be our religion, it can be even our family culture.
Hmm.
That all of that, right, tends to create when it becomes rigid tends to create a lot of pain for us.
Yeah.
So people often go, but this is the way we do it. This is our culture. This is our family tradition, right? And the pitfall is when we become rigid about what we quote unquote call culture or,
Hmm.
or tradition, right? It creates pain for people.
Yes.
People hold culture and tradition so sacred, and that's holding is so sacred. Like what it does, it doesn't allow us to really grow. And every
Yeah.
family, every couple, every individual that we've worked with often have that within the issues that they're bringing into the therapy room.
Can I respond to that just for a second?
Mhm.
That sounds like in the lectures that you give, I give, every all of us give, and that we talk about in our graduate classes.
Yeah.
When should a person seek out counseling? Right?
Mm.
When do I know I need therapy? Is the
Yeah.
question.
Yeah.
Right? And oftentimes the response is when the issue that you're facing exceeds the resources that you have to cope with it.
Yes.
And when you're talking about the rigidity,
Hmm.
that a lot of times that rigidity is fine when you're not tested beyond the system.
Exactly.
But when something introduces into the system that's beyond the system as it exists
Yep.
today,
Yep.
ability to cope with it,
Yep.
and you're trying to use the system to fix a problem that's beyond the system,
Yep.
you have double the stress. You have the issue itself, and then the
Yep.
stress of I'm trying to climb this wall
Right.
and I just can't.
Right.
Why is it not working?
Right. For
Right?
sure, for sure.
Yeah.
And we see it. Like, I mean, for example, if we talk about a couple, right? It might be things might be going well for them. And then they hit their second year of marriage or even their second year of dating. And it's like, well, this is the way my family does this.
Yeah.
I'm gonna do it this way. And sometimes
Yeah.
we're not even aware that we're saying that. We're just saying this is who I am. But when we look at it, we start to realize that what we say this is who we are is actually a
Right.
pattern of how we grew up in our family, and we want to
Mm-hmm.
hold the other partner to it,
Yeah.
right?
Yeah.
And also, families go through it when a 10-year-old, who they've always treated as a child, now all of a sudden at 12 is like, I don't want to do that anymore. The family's
Yes.
like, well, this is the way we've
Yes.
always done this. What's
That's
going
right.
on, right? So then
Mm-hmm.
they're like, okay, we need to come to therapy because we can't
Yep.
handle this kid
Yep.
anymore.
Yep.
And more so, the issue is the parents are just very kind of like, this is the way we handle
Mm-hmm.
this, and it works for us this way, and they don't know how to be more
Yep.
flexible or shift.
Yep.
So,
I had a husband tell me several times and continues to say, um, I don't understand, referring to his wife, I don't understand why this is a problem. It's never been a problem before. And his in his mind, he's like, because she's never raised this as an issue, it
right,
must not have been an issue.
Yeah.
And it's so hard for him to fathom that she was just suffering in silence, that perhaps it was always an issue, and she's reached her breaking point with
Yeah.
being able to be patient with it.
Yeah.
And
Yeah.
so, again, it's that the rigidity of ideas. A lot of times I say to people, the curiosity. You
Yeah.
know, like you have to be curious to ask yourself, why is this a problem now?
Mm-hmm.
Why am I hearing what I'm hearing? Why do I
Mm-hmm.
keep hearing the same complaints? You know, like
Mm-hmm.
don't just fight the issue, be curious about the issue,
Yeah.
investigate the issue,
Yeah.
right?
Yeah. No,
Can,
it's true.
can I ask you about this? You talked about the universality of
Yeah.
some of the experiences. Can you talk about, if you can, any of the kind of culture specific, community specific concerns that you've seen over the years of operating your practice?
Right. That's a good question too. I think that is hard to kind of like see sometimes, right?
Mm-hmm.
And I say that is hard to see sometimes because most of the time, and I'm not sure why this is, maybe it's also because of the ways in which we advertise and talk about our expertise in the practice, that we're focused on
Mm-hmm.
racial trauma, right?
Mm-hmm.
And also relational trauma as well. I think one of the differences that we've definitely seen is the ways in which each individual, based on their family of origin, right, deal with issues, right? So there's a general way of like, all of us have experienced pain and joy from our
Mm-hmm.
family of origin. So that is also universal. Now, the ways in which we experience that, right, is different for each individual, each couple, and each family. So I
Mm-hmm.
think one of the differences then that we definitely see is that everyone, yes, we all have general pain and struggle, but the ways in which we respond to it is different from each person's,
Yeah.
right? Some people are able to kind of really talk about it and not be choked up about it
Mm-hmm.
or not like suppress it, while some people definitely suppress a lot of their pain to the point that you're telling them or helping them to see, hey, I think this is an issue. And they're like, no, 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 that's not an issue. It's not an issue. I just want you to help me work on my anxiety. It's like your anxiety is connected to this particular issue that you don't want to talk about, right?
Mm-hmm.
While some people are very clear on, okay, I need to talk about this issue in order to deal with this anxiety that I'm going through, right? So I think that's the way in which people respond to their pain and what they bring into therapy. That's what I've seen as different.
Yeah.